My name is Rainier Urdaneta. I am a prosthodontist. I graduated at Boston University and I did my specialty degree there. Then I worked at Harvard Dental School where I taught for 4 years. That's actually where I met Dr. Slinen, and now I'm very happy we're working together again. I specialized in prosthodontics, so basically all the reconstruction procedures for the mouth, dentures and crown and bridges and implants. I do the surgical part of implants. I've been working at the Implant Dentistry Center in Boston for since the year 2002. I have been lucky to have had the opportunity to document some of my cases and publish some research on dental implants on several different journals in dentistry. And I am now part of the 1010 Dental, placing implants and restoring. When using dental implants, one of the things that make procedures really expensive is the grafting procedures. And there are several ways of grafting areas when we are missing bone. It is very common to use, for example, bone from cadavers and bone from cows and ovine bone and or artificial bone. One of the techniques that I am very excited about these days is the use of leukocyte and platelet-rich fibrin membranes coming from the same patient. Basically, what we do these days, instead of actually taking a piece of bone from a cow, we actually use the patient's very own white cells. We take blood from them, we put it in a centrifuge, which we have here at the center. We separate the white cells from the red cells, and we can actually grab the white cells and we can make a little piece of skin with those white cells, and we can use the patient's very own white cells and platelets and some of the stem cells that come in the blood, and we can use that to graft the procedure. So instead of actually using something from someone else, we're using your very own cells to regenerate your very own defects in the mouth or to treat your very own infections. When we have a patient that has a tooth with a fracture that needs to be extracted and the tooth is infected, I have found that the best way to treat those infections is actually to use the patient's very own white cells. It's like using their very own antibiotics to treat their very own infections. That usually leads to, or at least in my experience, has led to less dry sockets, less pain, faster healing, and the procedure is significantly less expensive than using bone from cadavers or bone from cows, which are very expensive to us, and therefore they are very expensive to patients. So we have reduced the fees significantly for grafting, and we are not doing so much graftings because now we have these latest techniques such as the leukocyte and platelet-rich fibrin membranes. One of the things I like about working here at 1010 is that we have several different specialties in the same center. So if a patient comes in and has a cavity, then we have dentists that can fill those cavities. If we have an infection in the gums, then we can treat those. If we have patients that that need a root canal, then we have a specialist that does root canals in here. If the tooth needs to be extracted, then we don't send the patient somewhere else to have it extracted, we have it here. All the things we need to do the extraction and place the implants and center. So it's a very good comprehensive place where we can have all the different specialties and all the different techniques. Not only that, we are all a group of friends, pretty much all dentists. We know each other, we've known each other for many years, and we work together really well. We would be very happy to have you as part of our family. Come, call us, schedule an appointment, and whatever your needs are, we can meet them here at 1010.